The 3 itchy spots on elderly people indicate a shortened lifespan. If you don't have any of these, living to 100 is no problem. Health and longevity are pursuits for everyone. When it comes to longevity, our first thought is often about genetic inheritance. However, research has found that the biggest factor influencing longevity is people's lifestyle habits. Sometimes seemingly conspicuous characteristics may actually be signals of diseases that can affect lifespan. If an elderly person experiences itching in these areas after the age of 60, it's a warning from the heavens that their lifespan is short. It's crucial to pay attention. Persistent itching in elderly individuals can signal underlying health issues that may impact lifespan. Consider the case of Mike, a 65-year-old retiree who began experiencing relentless itching in his armpits. At first, he attributed it to dry skin or an allergy, but as the itching worsened and over-the-counter treatments failed, his daughter urged him to consult a doctor. Tests revealed diabetes, a diagnosis that explained not only the itching, but also recent symptoms like dry skin and weight loss. This experience showed John, and us, the importance of addressing unexplained, persistent itching. Long life and health are goals shared by many. Although genetics play a role, research highlights lifestyle choices as even more critical in determining our lifespan. Subtle signs, such as prolonged itching in specific areas after age 60, can indicate serious health issues. Mrs. Smith, a 60-year-old woman, found this out firsthand when her months-long itching, initially dismissed as a seasonal annoyance, became unbearable. When she finally sought medical attention, tests uncovered lymphoma, a type of cancer that can cause itching when malignant lymphocytes release histamines. Roughly 20% of lymphoma patients experience persistent itching, underlining the need to seek medical care if unexplained itching lingers. Aside from cancer and diabetes, itching may also hint at other medical issues. Persistent itching around the anus, for example, often indicates conditions like hemorrhoids, anal fistulas, or even cancer. Nearly 75% of individuals with rectal or anal diseases report itching in the affected area. Mike's older brother, Robert, faced a similar situation when itching around his genital area interfered with his daily life. After seeing a doctor, he learned it was vulvitis, a condition linked to bacterial imbalance. The genital area's sensitivity makes it especially vulnerable to itching caused by issues like vaginitis or eczema, which often worsen if left untreated. In older adults, itchy lower legs are often connected to hypothyroidism. The reduced thyroid function slows metabolism, causing dry skin and dehydration, especially on the lower legs, which have fewer sweat and oil glands. Dr. Wong, a dermatology specialist, highlights that dry, flaky itching generally points to aging, while damp or persistent itching may signal illness. Conditions affecting liver and kidney function, for example, can lead to toxin buildup in the skin, resulting in darkened, rough, and itchy patches. Scratching is a quick relief but can worsen the problem, leading to skin damage, infections, and scarring. Instead, lifestyle adjustments help manage itching more effectively. During dry seasons, for instance, diet plays a big role. Reducing spicy, high-fat, and high-sugar foods while increasing vitamin and manganese-rich foods, such as cabbage, carrots, and mushrooms, can improve skin health. Proper hydration, sleep, and skin care are equally essential. Though it may seem minor, persistent itching, especially in areas like the armpits, genitals, and lower legs, can indicate health problems that deserve our attention. By seeking medical advice and making thoughtful lifestyle changes, we can address these warning signs early, supporting both our health and longevity. Here are 8 practical ways to help prevent and manage persistent itching, especially in elderly individuals. 1. Moisturize regularly, morning and evening. Apply a rich, fragrance-free moisturizer twice daily, ideally after bathing when skin is still slightly damp. This helps lock in moisture and protects against dryness, which is a common cause of itching. 2. Opt for lukewarm baths daily or every other day. Avoid hot water, which strips natural oils from the skin. Instead, take lukewarm baths or showers and limit time in the water to 10 to 15 minutes. Use mild, fragrance-free soaps or gentle body washes that won't dry out the skin. 3. Wear soft, breathable fabrics all day. Choose loose-fitting clothes made from soft, natural fibers like cotton, which allow skin to breathe and reduce irritation. Avoid wool and synthetic fabrics, which can aggravate itching, especially in sensitive areas. 4. Maintain hydration throughout the day. Drink enough water to keep skin hydrated from the inside out, especially during dry seasons or in heated indoor environments. Aiming for about 8 glasses a day is ideal unless directed otherwise by a healthcare provider. 5. Humidify your living space, especially in winter. Use a humidifier in your bedroom or main living area, especially in dry winter months, to maintain a moisture-rich environment and prevent skin from drying out and becoming itchy. 6. Limit high sugar and spicy foods during meals. High sugar and spicy foods can worsen inflammation and itching. Instead, favor a balanced diet rich in vegetables, whole grains, lean proteins, and foods high in vitamins and minerals like carrots, leafy greens, and nuts. 7. Take frequent breaks to stretch and move every hour. Sitting for long periods can lead to poor circulation and skin discomfort, especially in areas prone to dryness. Get up, stretch, or walk around every hour to increase blood flow and alleviate pressure on areas like the lower legs. 8. Avoid scratching. Use a cold compress as needed. Resist scratching, as it can damage the skin and lead to infections. Instead, apply a cold compress or ice pack wrapped in a cloth to itchy areas for 10 to 15 minutes to soothe the skin and reduce the urge to scratch. Research shows that malignant lymphocytes in lymphoma produce biologically active substances, like histamine, which are carried to the skin through the bloodstream. This constant stimulation of the sensory nerve endings causes intense itching in about 20% of lymphoma patients. When itching appears unexplained and resists treatment, it may be a warning sign of lymphoma. In lymphoma, the itching is uniquely persistent and unresponsive to typical remedies. Unlike common itchiness that can be relieved with moisturizers or antihistamines, lymphoma-related itching remains intense and unyielding. Often, this itching lacks visible skin changes like rashes or bumps, which can make it harder to diagnose and delay medical attention. Lymphoma-related itching can emerge suddenly and catch people off guard. Unlike itchiness from dry skin or allergies, which can appear gradually, this type of itching starts unexpectedly, resisting seasonal changes and temperature shifts. Its persistence, regardless of environment, indicates a serious underlying cause. Alongside persistent itching, lymphoma can cause other symptoms: painless but firm lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, and anemia. These symptoms, when present together, strongly suggest the need for medical evaluation. Swollen lymph nodes often appear in the neck, armpits, or groin and can go unnoticed because they are typically painless. Low-grade fevers in lymphoma are often overlooked or mistaken for mild infections. But a long-lasting fever without an obvious cause signals the body's response to malignant cells. Similarly, lymphoma-related night sweats are intense and drenching, disrupting sleep and exhausting the individual. Unexplained pain, weight loss, and anemia can also point to lymphoma. This pain may arise in lymph nodes or other areas without a clear cause. Rapid, unintentional weight loss, especially without dietary changes, is concerning and should prompt further evaluation. Anemia in lymphoma occurs as the body struggles to produce healthy red blood cells, leading to fatigue and weakness. To minimize the risk of persistent itching or manage it effectively, especially if you're concerned about lymphoma, here are 5 proactive habits and guidelines. 1. Conduct regular self-exams for lymph node swelling. Check for any unusual lumps or swelling in lymph node areas, such as your neck, armpits, and groin. When, perform a self-check monthly. How? Gently press around these areas to feel for any new or enlarged nodes. If you notice persistent swelling, consult a healthcare provider. 2. Prioritize good skin hydration and care. Keep your skin moisturized and protected from irritants to prevent general itchiness that can mask more serious conditions. When, moisturize after bathing, especially in dry weather, to lock in hydration. How? Use gentle, fragrance-free moisturizers. Avoid hot showers, which can dry out the skin and cause itching. Regular hydration will help differentiate between normal dryness and itching that could signal an underlying issue. 3. Monitor your body for persistent, unexplained symptoms. Keep track of any ongoing itching, low-grade fevers, night sweats, or unexplained weight loss. Document any symptoms that persist beyond 2 weeks, especially if they don't respond to typical treatments. How? Maintain a symptom journal to track severity, frequency, and response to any medications. This will help you and your doctor identify patterns and consider whether further evaluation is needed. 4. Avoid self-treating persistent itching with over-the-counter medications. If itching doesn't respond to typical remedies like antihistamines or creams, seek medical advice instead of trying multiple over-the-counter solutions. After 1 to 2 weeks of persistent itching that doesn't respond to moisturizers or antihistamines. How? Schedule a consultation with a healthcare provider to investigate underlying causes rather than simply masking the symptom, as persistent itching could indicate a more serious condition. 5. Cultivate stress-relieving habits. Engage in stress management practices, as stress can exacerbate skin sensitivity and immune function. Integrate stress-relieving activities like meditation, yoga, or regular exercise into your daily or weekly routine. How? Set aside at least 15 to 30 minutes each day for a stress-relieving activity. Stress reduction supports overall immune health, which may help you catch unusual symptoms early and reduce general itching from skin irritations related to stress. Each of these habits supports overall well-being and promotes early detection, making them valuable practices for both preventing and managing unexplained itching. Vigilance toward these symptoms is essential. Persistent itching that doesn't respond to standard treatments, along with lymph node enlargement, low-grade fever, night sweats, pain, weight loss, or anemia, signals the need for prompt medical advice. Early detection of lymphoma is crucial, and recognizing these signs can significantly improve treatment outcomes. Persistent skin irritation, often dismissed as a minor issue, can reveal deeper health concerns when it doesn't respond to typical remedies. Targeted discomfort in specific areas without an obvious cause may point to underlying conditions, warranting closer attention. Let's explore how localized irritation can signal potential health issues. Discomfort in the armpits, for instance, may relate to diabetes. Elevated blood sugar disrupts nerve function and the autonomic system, leading to dry, irritated skin due to reduced sweat and sebum production. This irritation is often seasonal, worsening in the dry autumn and winter months. Diabetic patients, especially those with obesity, may experience persistent underarm discomfort due to excessive sweating, creating a perfect environment for bacterial and fungal overgrowth. Around the anus, irritation often arises from anal or rectal conditions. Conditions such as hemorrhoids, anal fistulas, or cancers in the area can trigger this discomfort. Initially mild and localized to one side, it can intensify, spreading if untreated. This type of irritation may be especially distressing at night, significantly impacting daily life. For women, genital discomfort frequently indicates gynecological issues. Conditions like vaginitis, vulvitis, eczema, or genital warts can cause intense irritation. Vulvitis, in particular, can result from an imbalance in vaginal flora, encouraging harmful bacteria to thrive. This leads to painful, burning sensations, especially during urination, and worsens with scratching. Lower leg irritation may suggest hypothyroidism. Diminished thyroid hormone production and a slower metabolism contribute to dry, flaky skin, particularly on the legs, where sebaceous and sweat glands are sparse. This dryness becomes especially pronounced in autumn and winter, marked by tingling, scaliness, and a cold, pale appearance. Scalp discomfort might indicate conditions like psoriasis or seborrheic dermatitis. These issues cause dryness, flakiness, and inflammation, leading to chronic irritation. Although dandruff is a common, less severe cause, persistent scalp issues may signal more serious conditions requiring professional attention. Discomfort on the palms and soles could suggest liver disease. When the liver fails to process toxins effectively, they accumulate, triggering irritation. Accompanying symptoms may include jaundice, fatigue, and unexplained bruising, all pointing to a need for medical evaluation. In the ears, persistent irritation might signal infections or chronic issues like eczema or psoriasis. This discomfort can also bring other symptoms such as discharge or hearing loss, necessitating medical assessment. Irritation around the eyes may stem from allergic reactions or conditions like eczema. This delicate area is easily inflamed by allergens, leading to chronic rubbing and scratching, which can worsen the problem. Back discomfort can point to shingles, especially if accompanied by a painful rash. Shingles, caused by a reactivation of the varicella-zoster virus, demands prompt attention to control symptoms and prevent further complications. On the feet, localized irritation could indicate athlete's foot, a fungal infection thriving in warm, moist environments. It can cause peeling skin and secondary bacterial infections, often needing antifungal treatment. For some, facial discomfort around the mouth and nose may be linked to rosacea. This chronic condition causes redness, swelling, and sensitivity, typically triggered by environmental factors, and requires tailored treatment for relief. Persistent irritation on the hands, particularly sudden and without an apparent cause, might suggest eczema or contact dermatitis. These conditions lead to intense discomfort, redness, and cracked skin, often requiring medical treatment. Finally, generalized skin discomfort that persists without specific localization can signal systemic conditions, such as lymphoma or certain cancers. This discomfort often coexists with symptoms like fatigue, weight loss, and night sweats, requiring a thorough medical evaluation. While occasional skin irritation is common, persistent discomfort in specific areas can hint at underlying health issues. Recognizing these signs and seeking medical advice when standard treatments fail is essential. Early detection and treatment of root conditions can vastly improve health outcomes and quality of life. Let's explore this topic together, like a chat between friends. Itching, something we all know, but did you know there are different types? Dry itching and damp itching, each with distinct causes and clues about our health. Dry itching often appears as we age. Imagine elderly skin, drier, sometimes flaky, and more prone to itching. As we grow older, our skin produces less oil and sweat. Add in dry weather or low hydration, and it's no surprise our skin starts to itch, much like chapped lips in the winter. To soothe it, keeping our skin moisturized is essential. Think of it as giving our skin a drink. A quality moisturizer restores the natural barrier that locks in moisture, while a humidifier at home can be a lifesaver during winter. And of course, staying hydrated by drinking water helps too. Each small step can bring welcome relief. Damp itching, on the other hand, points to internal health issues. When our liver or kidneys are struggling, toxins build up in the body, sometimes causing skin changes, darkened, rough, or swollen areas that itch. High blood sugar is also a common culprit. People with diabetes often experience increased itchiness because high glucose affects skin texture. Controlling blood sugar in partnership with healthcare can keep this itching at bay. Damp itching can also appear in more humid areas, like the perineum, where infections or fungal growth thrive. Good hygiene is crucial here. Keeping these areas clean and dry, and sometimes using antifungal treatments, helps manage this discomfort. When liver and kidney issues lead to damp itching, they're unable to detoxify our system efficiently, causing toxins to accumulate. Our skin, the body's largest organ, often reflects these internal imbalances. Besides itching, you may notice discoloration, rough patches, or swelling. Sometimes, scratching can lead to secondary infections like folliculitis or lymphangitis, conditions that require medical care. Folliculitis, for instance, occurs when hair follicles become infected by bacteria, causing painful, red bumps that itch and sting. Treating it may require antibiotics, along with consistent skincare. Lymphangitis, another complication, involves inflammation of the lymphatic channels and happens when bacteria enter through a scratch, leading to fever, red streaks, and swollen lymph nodes. Signs that urgent medical attention is needed. To manage itching effectively, different approaches help each type. For dry itching, regular moisturizing and gentle skincare are key. Avoiding hot showers, which strip away natural oils, and using a humidifier maintains skin hydration. Drinking plenty of water is equally vital, nourishing our skin from within and promoting overall skin health. For damp itching, it's about addressing the root cause. If it's related to liver or kidney function, working with a healthcare provider to manage these conditions is crucial. Similarly, managing blood sugar levels can help reduce itching for people with diabetes. Proper hygiene and appropriate treatments are necessary for areas prone to moisture and infections. To manage itching effectively, we can take proactive steps that go beyond simply scratching. Simple lifestyle changes, mindful skincare, and a balanced diet can make a substantial difference. Wearing loose, breathable clothing can minimize moisture buildup and prevent irritation. Opting for mild, fragrance-free soaps can also protect our skin's natural moisture barrier, reducing the risk of dryness and discomfort. Regular checkups with healthcare providers are essential for monitoring any underlying conditions, such as liver or kidney issues or high blood sugar, that might contribute to itching. By managing these health concerns, we help reduce skin-related symptoms and improve overall well-being. Recognizing the type of itching we're experiencing, whether dry or damp, is key to choosing the right approach. Dry itching, common in cooler months, can often be addressed with hydration and gentle skincare. Damp itching, however, may signal underlying health concerns and requires a more comprehensive approach. By observing these distinctions, we can take targeted steps to alleviate discomfort and protect our skin. While scratching might offer instant relief, it often worsens the situation over time, leading to skin thickening, pigmentation changes, or even infection. For lasting relief, we can try cold compresses or gentle tapping to soothe the area without causing further damage. Let's explore this topic together, like a chat between friends. Itching, something we all know, but did you know there are different types? Dry itching and damp itching, each with distinct causes and clues about our health. Dry itching often appears as we age. Imagine elderly skin, drier, sometimes flaky, and more prone to itching. As we grow older, our skin produces less oil and sweat. Add in dry weather or low hydration, and it's no surprise our skin starts to itch, much like chapped lips in the winter. To soothe it, keeping our skin moisturized is essential. Think of it as giving our skin a drink. A quality moisturizer restores the natural barrier that locks in moisture, while a humidifier at home can be a lifesaver during winter. And of course, staying hydrated by drinking water helps too. Each small step can bring welcome relief. Damp itching, on the other hand, points to internal health issues. When our liver or kidneys are struggling, toxins build up in the body, sometimes causing skin changes, darkened, rough, or swollen areas that itch. High blood sugar is also a common culprit. People with diabetes often experience increased itchiness because high glucose affects skin texture. Controlling blood sugar in partnership with healthcare can keep this itching at bay. Damp itching can also appear in more humid areas, like the perineum, where infections or fungal growth thrive. Good hygiene is crucial here. Keeping these areas clean and dry, and sometimes using antifungal treatments, helps manage this discomfort. When liver and kidney issues lead to damp itching, they're unable to detoxify our system efficiently, causing toxins to accumulate. Our skin, the body's largest organ, often reflects these internal imbalances. Besides itching, you may notice discoloration, rough patches, or swelling. Sometimes, scratching can lead to secondary infections like folliculitis or lymphangitis, conditions that require medical care. Folliculitis, for instance, occurs when hair follicles become infected by bacteria, causing painful, red bumps that itch and sting. Treating it may require antibiotics, along with consistent skincare. Lymphangitis, another complication, involves inflammation of the lymphatic channels and happens when bacteria enter through a scratch, leading to fever, red streaks, and swollen lymph nodes. Signs that urgent medical attention is needed. To manage itching effectively, different approaches help each type. For dry itching, regular moisturizing and gentle skincare are key. Avoiding hot showers, which strip away natural oils, and using a humidifier maintains skin hydration. Drinking plenty of water is equally vital, nourishing our skin from within and promoting overall skin health. For damp itching, it's about addressing the root cause. If it's related to liver or kidney function, working with a healthcare provider to manage these conditions is crucial. Similarly, managing blood sugar levels can help reduce itching for people with diabetes. Proper hygiene and appropriate treatments are necessary for areas prone to moisture and infections. To manage itching effectively, we can take proactive steps that go beyond simply scratching. Simple lifestyle changes, mindful skincare, and a balanced diet can make a substantial difference. Wearing loose, breathable clothing can minimize moisture buildup and prevent irritation. Opting for mild, fragrance-free soaps can also protect our skin's natural moisture barrier, reducing the risk of dryness and discomfort. Regular checkups with healthcare providers are essential for monitoring any underlying conditions, such as liver or kidney issues or high blood sugar, that might contribute to itching. By managing these health concerns, we help reduce skin-related symptoms and improve overall well-being. Recognizing the type of itching we're experiencing, whether dry or damp, is key to choosing the right approach. Dry itching, common in cooler months, can often be addressed with hydration and gentle skincare. Damp itching, however, may signal underlying health concerns and requires a more comprehensive approach. By observing these distinctions, we can take targeted steps to alleviate discomfort and protect our skin. While scratching might offer instant relief, it often worsens the situation over time, leading to skin thickening, pigmentation changes, or even infection. For lasting relief, we can try cold compresses or gentle tapping to soothe the area without causing further damage. Diet plays a vital role in managing itching and supporting skin health. We should reduce high-fat, sugary, and spicy foods that can trigger inflammation, opting instead for manganese-rich foods like radishes, cabbage, and sweet potatoes, which support skin health. Including vitamins from sources like animal liver, carrots, and mushrooms further helps keep skin resilient and less prone to irritation. Seasonal dryness, especially in autumn and winter, is another common cause of itching. This isn't limited to older adults. Anyone can experience dry, itchy skin if they skip proper skincare. Ensuring restful sleep and avoiding excessive scratching are simple yet effective ways to keep our skin healthy. Cold water face washes and limiting hot baths can also help, preserving the skin's natural oils. Moisturizing after bathing seals in hydration, making skin more supple and less vulnerable to irritation. Adjusting our environment can also prevent itching. Regulating home humidity levels, avoiding irritants, and keeping living spaces clean contribute to healthier skin. Identifying and avoiding triggers, whether specific fabrics, soaps, or stress, helps reduce itching episodes and improve comfort. Consuming nutrient-rich foods like carrots for vitamin A and citrus fruits for vitamin C supports skin elasticity and hydration. Building a consistent skincare routine that includes gentle cleansing, moisturizing, and protecting our skin from environmental stressors, like sun exposure or dry indoor air, keeps our skin resilient. Here are some examples that highlight how consuming specific nutrients and adopting certain skincare habits can support skin health and resilience. 1. Berries and leafy greens for antioxidants. Consuming berries like strawberries, blueberries, and raspberries, and leafy greens like spinach and kale provides antioxidants, which help fight free radicals that damage skin cells. This antioxidant boost supports skin repair and a youthful glow. 2. Fatty fish for omega-3s. Fatty fish like salmon, sardines, and mackerel are rich in omega-3 fatty acids. Omega-3s help maintain skin moisture and elasticity, reducing dryness and inflammation. Including these in your diet a few times a week can enhance skin suppleness. 3. Nuts and seeds for vitamin E. Nuts and seeds, particularly almonds and sunflower seeds, are great sources of vitamin E. Vitamin E helps protect the skin from oxidative stress caused by UV rays and environmental pollution, which helps maintain its strength and resilience. 4. Sweet potatoes for beta-carotene. Like carrots, sweet potatoes are rich in beta-carotene, which converts to vitamin A in the body. Vitamin A supports skin cell turnover, which helps keep the skin smooth and reduces dullness. 5. Hydrating with water and green tea. Drinking plenty of water keeps the skin hydrated from the inside out. Additionally, green tea contains polyphenol, which are known to reduce inflammation and protect skin cells, enhancing skin clarity and elasticity. 6. Daily sunscreen for UV protection. Applying a broad-spectrum sunscreen every day, even on cloudy days, shields the skin from harmful UV rays. This protection prevents premature aging, sunspots, and skin damage that compromise elasticity. 7. Humidifier for dry indoor air. Indoor heating during winter can make the air extremely dry, which saps moisture from the skin. Using a humidifier adds moisture to the air, which helps the skin retain its hydration and prevents it from becoming flaky and tight. 8. Gentle exfoliation with AHAs/BHAs. Regular exfoliation with products containing gentle alpha or beta hydroxy acids, like glycolic or salicylic acid, helps remove dead skin cells, promoting a smoother texture. This encourages healthy cell turnover, which supports elasticity. 9. Night cream with hyaluronic acid for overnight hydration. Using a night cream that contains hyaluronic acid helps retain moisture, as hyaluronic acid binds water to the skin. This extra boost of hydration during sleep makes skin appear plump and elastic in the morning. 10. Face massage for circulation. A light facial massage while applying moisturizer helps stimulate blood circulation, bringing more oxygen and nutrients to the skin. This promotes cell regeneration, supporting a fresh and firm complexion. Listening to our body and responding to its signals is crucial. If our skin feels dry or irritated, we should act right away. This may mean applying moisturizer more often, adjusting our diet, or tweaking our skincare routine. By staying attentive, we can manage itchiness and keep our skin healthy. Though skin itching itself isn't a disease, it can reveal a lot about our health. Persistent itchiness can signal underlying issues like eczema, psoriasis, or allergies. In some cases, prolonged itching might indicate more serious conditions: liver disease, kidney failure, or even certain cancers. Recognizing these symptoms is essential because ignoring them can lead to greater problems. Unchecked scratching can cause skin damage, infections, and scars, worsening the original issue. The constant discomfort also takes a toll on our quality of life, disturbing sleep, and sometimes leading to anxiety or depression. By understanding the causes of skin itchiness and taking action, we can avoid these complications and boost our overall well-being. If itching persists, it's wise to seek medical advice. Early diagnosis makes a big difference, allowing a healthcare professional to identify the root cause and suggest treatments, whether that involves topical solutions, lifestyle changes, or additional tests. Addressing itchiness early means better management and lasting relief. Thank you for joining us. If you found this helpful, consider giving us a thumbs up, subscribing, or sharing with friends. Your support means a lot, and we look forward to seeing you in the next video.